Hello everyone. Welcome to today's video where we'll discuss the management of acute pain. Before we dive into the details, let's start with some USMLE-style questions to test your knowledge and help set the stage for our topic. 1. What is the maximum daily dosage of paracetamol, acetaminophen, for adults? A. 2 grams. B. 3 grams. C. 4 grams. D. 5 grams. Answer: C. 4 grams. Explanation: for adults, the maximum recommended dosage of paracetamol is 4 grams per day. This is to avoid toxicity and potential liver damage. 2. Which of the following is a common side effect of NSAIDs? A. Hyperglycemia. B. Gastric ulceration. C. Bradycardia. D. Hypertension. Answer: B. Gastric ulceration. Explanation: nonsteroidal anti-inflammatory drugs, NSAIDs, can cause gastric ulceration and bleeding. This is because they inhibit the production of protective gastric mucosa. 3. What is a primary consideration when using opioids for pain management in the elderly? A. High dosage requirements. B. Increased risk of respiratory depression. C. Enhanced efficacy compared to younger patients. D. No special considerations are needed. Answer: B. Increased risk of respiratory depression. Explanation: elderly patients are more susceptible to respiratory depression from opioids, so dosage must be carefully managed. 4. When should NSAIDs be avoided? A. For mild headaches. B. In patients with peptic ulcer disease. C. For acute low back pain. D. After a minor surgical procedure. Answer: B. In patients with peptic ulcer disease. Explanation: NSAIDs should be avoided in patients with peptic ulcer disease due to the risk of exacerbating the condition and causing bleeding. 5. What is a common treatment approach for acute pain? A. Immediate use of high-dose opioids. B. Combination of different types of medications. C. Exclusive use of cold compresses. D. Long-term pain management strategies. Answer: B. Combination of different types of medications. Explanation: multimodal treatment, which combines different types of medications, can provide effective pain relief while minimizing side effects. Now, let's dive into the topic of acute pain management. Pain is an unpleasant sensory and emotional experience linked to actual or potential tissue damage. It is influenced by a variety of factors and can vary significantly from person to person. Acute pain, in particular, lasts for less than 3 months and is usually due to identifiable causes such as trauma, surgery, or acute illness. When managing acute pain, it's essential to have a tailored approach for each patient, addressing both analgesia and the underlying condition. Special considerations are necessary for certain populations, including children, the elderly, pregnant women, individuals with liver or kidney disease, and those who are opiate tolerant or have a history of substance abuse. Common causes of acute pain include traumatic musculoskeletal injury, surgery, burns, labor and delivery, headache, sickle cell crisis, myocardial infarction, acute abdomen, like acute pancreatitis, joint inflammation, and others. The symptoms and signs of acute pain depend on its underlying cause, so investigations should focus on identifying the root cause of the pain. The objectives of treating acute pain are: to resuscitate the patient if necessary, to relieve pain, to treat any underlying disorder. Non-pharmacological treatments for acute pain include placing the affected body part in the most comfortable position, elevating the affected area where appropriate, using splinting when indicated, applying cold or warm compresses as needed, providing reassurance to the patient. Pharmacological treatments include paracetamol, acetaminophen for adults, The oral dosage is typically 0.5 to 1 gram every 6 hours, with a maximum of 4 grams per 24 hours. For intravenous administration, 1 gram every 6 hours is common. Pediatric doses vary, but for children, it's usually 15 mg/kg every 6 hours. Nonsteroidal anti-inflammatory drugs, NSAIDs examples include diclofenac and ibuprofen. NSAIDs should be used with caution due to potential adverse effects like gastric ulceration, impaired renal function, and platelet dysfunction. They are contraindicated in patients with peptic ulcer disease, coagulation issues, or severe renal impairment. Opioids, tramadol, 50 to 100 mg every 4 to 6 hours, with a maximum of 400 mg daily. Pethidine, 25 to 50 mg every 4 hours, IM, or 25 mg, 4, with caution for elderly patients. Morphine, 1 to 2 mg boluses, 4, or 5 to 10 mg every 4 hours, IM, for adults. Doses are adjusted for children based on weight. Nerve blocks with local anesthetic agents, lidocaine and bupivacaine are used for nerve blocks to provide localized pain relief. Multimodal treatment, combining different types of medications, can enhance pain relief while reducing the dosage of each individual drug. Examples include combining paracetamol with NSAIDs or opioids. Referral criteria: if the underlying condition causing the pain does not improve or if adequate pain relief is not achieved with the recommended doses, a referral to a specialist should be considered. Pain is an unpleasant sensory and emotional experience linked to actual or potential tissue damage. It is influenced by various factors and can vary significantly from person to person. Acute pain, in contrast to chronic pain, lasts for less than 3 months and arises from identifiable causes such as trauma, surgery, or acute illness. Managing acute pain requires a tailored approach for each patient and should address both analgesia and the underlying condition. Special considerations and precautions are necessary for children, the elderly, pregnant women, individuals with hepatic or renal disease, and those who are opiate tolerant or have a history of substance abuse. Common causes of acute pain include traumatic musculoskeletal injury, surgery, burns, labor and delivery, headache, sickle cell crisis, myocardial infarction, acute abdomen, e.g., acute pancreatitis, joint inflammation. Others. Symptoms and signs of acute pain depend on the underlying cause. Investigations should be directed at identifying the cause. Treatment objectives are to resuscitate the patient if necessary, relieve pain, treat any underlying disorder. Non-pharmacological treatments include placing the affected part in the most comfortable position where appropriate, elevation of the affected part where indicated, splinting when indicated, applying cold or warm compresses as needed, providing reassurance. Pharmacological treatments include paracetamol, acetaminophen. Adults, oral, 0.5 to 1 g every 6 hours, maximum 4 g/24 hours. For adults weighing 60 kilograms, the dose is 15 mg/kg every 6 hours, maximum 60 mg/kg/24 hours. Rectal, 1 g every 6 hours, maximum 4 g/24 hours. For adults weighing 60 kilograms, the dose is 15 mg/kg every 6 hours, maximum 60 mg/kg/24 hours. 4. Intravenous should be given slowly over 15 minutes 1 g every 6 hours, maximum 4 g/24 hours. For adults weighing 60 kilograms, the dose is 15 mg/kg every 6 hours, maximum 60 mg/kg/day. Pediatric doses, oral, children, 15 mg/kg every 6 hours, maximum 60 mg/kg/24 hours. Neonates, 10-15 mg/kg every 8 to 12 hours, maximum 30 mg/kg/24 hours. Rectal, same as oral dose above but with a loading dose, first dose only, of 30 mg/kg for children and full-term neonates. 4. Children weighing 10 kg, 15 mg/kg every 6 hours, maximum 60 mg/kg/24 hours. Children weighing 10 kg and above 2 months, 7.5 mg/kg every 6 hours, maximum 30 mg/kg/24 hours. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs should be used with caution due to potential adverse effects such as exacerbation of peptic ulcer disease, platelet dysfunction, renal function impairment, bronchospasm in asthmatic patients, and fluid retention. NSAIDs are contraindicated in patients with peptic ulcer disease, coagulation or bleeding problems, impaired renal function, heart failure, and pregnant women, especially in the third trimester. They should also be used cautiously in elderly patients. Examples: diclofenac, oral, 25 to 50 mg every 8 hours or 75 mg every 12 hours. Rectal, 50 mg every 12 hours or 100 mg every 18 hours. IM, 25 to 50 mg every 8 hours or 75 mg every 12 hours, maximum 150 mg/day. Ibuprofen, oral, 400 mg every 6 to 8 hours. Children, 20-30 mg/kg daily in 3 divided doses, maximum 1.2 g per day. Opioids. Tramadol, oral, 50 to 100 mg every 4 to 6 hours, maximum 400 mg daily. Pethidine, IM, adults, 25 to 50 mg, approximately 1 mg/kg, every 4 hours, lower dose for the elderly. Children, 1 mg/kg, maximum 50 mg, every 4 hours. 4. Adults, 25 mg, repeated if necessary with caution. Morphine, 4. Adults, 1 to 2 mg boluses, repeated if necessary with caution. IM, adults, 5 to 10 mg every 4 hours. Children, 0.1 mg/kg, maximum 5 mg, every 4 hours. Nerve blocks with local anesthetic agents. Lidocaine. Bupivacaine. Multimodal treatment. Combining different types of medications can enhance pain relief while limiting the dosage of each drug, which improves effectiveness. Examples include paracetamol and opioid, paracetamol and NSAID, paracetamol, NSAID, and opioid. Referral criteria: refer patients if the underlying condition does not improve or pain relief is not achieved with the recommended doses. That wraps up our discussion on acute pain management. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated on our latest content. Leave your comments or questions below, and we'll see you in the next video.